The National Command Council is taking the fight against COVID-19 outside of clinics and hospitals and into the homes, churches, taxis and social environments of the country. This is as the Health and Social Development Departments launch the Ministerial Advisory Committee on Behavioral Change to advise the NCC on just how to mobilize communities in the fight against the coronavirus. Now, the launch comes hot on the heels of Minister Lindiwe Zulu being in the news, perhaps over a handling of the pandemic's impact on the poor. But exactly what is the work of this new committee that has now been announced? Plenty of questions we have to ask the Minister of Social Development, Lindiwe Zulu, who joins us now on the line. Minister, good morning. Thanks very much for your time. Plenty of reaction already on social media and just in the news discourse around the announcement of this new ministerial committee. Do you think that this is what South Africa really needs right now as we come to the peak of COVID-19 and the number of infections?
Yes, exactly. This is what South Africa needs, not only for today, but this is what South Africa needs for the future. What South Africa needs for the future is a coordinated effort and working together. What South Africa needs is a government that will be able to work with other organizations to look into the challenges that are facing South Africa, even beyond COVID-19. As we clearly indicated, this committee, it's two ministers so far, and the rest of the members of the committee are from civil society organizations. I wouldn't name them all, but there's quite prominent organizations that everyone is aware of, and NPOs. So South Africa does need to work from a united front, because what is confronting us right now is beyond government alone. What is confronting us is making sure that we have to work with our communities in order to defeat it, if we were to. And exactly the same thing, may I quickly just say to you, we wish to thank the police and for being on the front in terms of arresting, at least arresting the man who is suspected of having been involved in the killing and death of Tleho. So South Africa needs a united front and working together. Only working together can we be able to deal with the monsters that face us. We are being faced by COVID-19 right now, but the other big challenge that we have is that of violence against women and children and the killing of young women.
So, Minister, how does one track the success of such a committee?
Well, you will track it by seeing the impact of the work that we will be doing in communities. Remember that the responsibility of the communities, of the committee, is really to provide advice on social and cultural factors that may relate to the spread of COVID-19 as it pertains to different sectors of society. To provide on social and cultural interventions that may also assist in the mitigation of the spread. And the mitigation of the spread, as I'm sure you know, people have to wear masks. People have to keep social distance. People have to be responsible and not wait for being policed in doing that. People have to be hearing and understanding and appreciating that they have to keep the distance, they have to wear the mask. People have to do that themselves. So this committee will have to help us in the appreciation and understanding, for instance, what is it that we can do within communities for people to understand that. You know, people don't have to be policed for wearing masks. People don't have to be policed for keeping a distance, because people have to have an appreciation. I step out of my home, there's a potential I'm going to come back with it. And when I come back with it, what does that mean for my family? What does it mean for people around me? And then the committee also has to advise us on the roles of different sectors of civil society in the response to the epidemic. And also just assist us in terms of identifying the areas that are a bit difficult for us to deal with. But this is a government-led, but it's got to be a committee that really assists. And it's not going to end up with just the committee itself. We're going to be looking at other departments that are very important for this, like the Department of Sports, Arts and Culture, like the Department of Education. But basically, we want to make sure that we are coordinated in our efforts to fight this. And then, as I said to you, we're looking beyond COVID-19, because behavioral change is what builds communities. Behavioral change is what builds a nation. If people don't see a necessity and importance for them to contribute towards the well-being of themselves and people around them, then the nation has got a problem.
Minister, I think South Africans would perhaps be forgiven if they have a lack of trust in your department, particularly given your comments around the fact that you did not know that the COVID-19 pandemic would have a huge effect, a huge impact on the poor and the vulnerable. A lot of people asking questions around whether your department, whether you indeed, Minister, given those kinds of comments, would be best placed to know what communities need right now.
I wish I could have known anyone else who knew the impact of COVID before it arrived. I think that the global world, the world itself, everybody where they're sitting, they never had an understanding of the impact of COVID. We didn't know what COVID is, and now we know what it is, and immediately we knew what it is, we started acting against it. That is the reason why we have the National Command Council. That is why we have structures at provincial and local level. That is why this very same government, this very same department is now distributing 350 rands to those that are unemployed, which is but one element of a bigger picture of what the government of the African National Congress has been doing to mitigate the situation. It's way bigger than just the Department of Social Development and us distributing 350 rands. It was also about increasing even the normal social grants that we had to increase in order for us to be able to help our people. So here's the bottom line. Nobody knew the impact of COVID, and that includes me. I didn't know what the impact of COVID was going to be, but immediately we knew what it was going to be from the very beginning. We started working together collectively as a government to confront it.
All right, Minister, let me ask you this question around the issue of feeding schemes. That was another issue that was, again, it received quite a lot of criticism, and rightly so, just because of all of the red tape around institutions that really were working to feed the most vulnerable, the poorest in our communities. As you say, you didn't know that they would be as badly affected, but these were organizations that were trying to meet that need at that moment. What is the plan, and how's your department recovered so far in terms of helping those institutions who want to help their own communities to make it easier for them to operate when it comes to feeding schemes? Then, of course, Minister, the very important question around children who depend on their school feeding schemes for that one meal that they might get in the day. What's your department done to address these very important issues around hunger in South Africa?
Yes, let me start by what the department itself has done. The department has got tried and tested old system of assisting in terms of food distribution through SASSA, which we call the SRD, the Social Relief of Distress. We've also got schemes that we normally do under normal circumstances when children can go to school, when people can go to centers where they can be able to get the feed. But came COVID, it meant that we're not able to have people walking into the places. But we did knock and drop. We dropped the food in those places. Not adequate, obviously, because normally our feeding scheme are very small on the basis that we focus on areas that have had disaster. This time around, the entire country has got disaster, and therefore we needed to see what else can we do, and doing it with dignity. That's why we're doing the knock and drop. We're still doing the knock and drop and dropping the food at home. The other issue that I need to clarify very quickly is that none of us, not me, not the department, ever stopped anyone from distributing food to the communities. This is what we said. one, there is COVID-19 out there. So the more you brought people out into the street, into long queues to come and collect the food, the more the chances was that people were going to infect each other. So our plea was do it in an orderly manner, do it coordinated with your local structures and your provincial structures, and talking to the communities. If you can, it's best to even drop the food at the homes, because let me tell you, Ayanda, one of the things that hurts me, quite frankly, is that we should, as South Africans, work towards ensuring that everybody doesn't go home hungry. We therefore need to work with each other to make sure that even post-COVID, the same food that we're seeing coming out now, the same food must be there for our people, because food is an essential. Food is something that everybody needs. We are not stopping any organization from doing feeding schemes. What we are asking them, do everything to make sure that the protocols of COVID are adhered to, make sure that people are wearing masks, make sure that people keep the distance, make sure that you do that with dignity, because it's not very much dignity when people have to be shuffling and shoving and pushing in queues simply because they're looking for food, when actually we can be able to distribute that food in a decent manner.
Minister of Social Development, Lindiwe Zulu, thanks very much for your time this morning on the AM report. The Minister's Department, along with the Department of Health there, launching that committee on behavioural change to advise the National Command Council on how to mobilise communities in the fight against COVID-19.